Namaste. I am Dr. Meet Kumar and I am a hematologist and bone marrow transplant physician working at Marengo Asia Hospitals, Gurugram and Faridabad. Today we will be discussing about a very interesting topic called bone marrow transplant, and what I will try to focus in next 2 minutes is about the myths that are circulated around bone marrow transplant. First myth: bone marrow transplant is a surgery. So I would like to clear: bone marrow transplant is not a surgery. It is a medical procedure that involves administration of medicines. The process that it undergoes is the stem cells are collected from the patient in case of autologous transplant, and in case of a donor, that is separate from the patient in case of allogenic transplant. After that, the patient receives a chemotherapy that varies for duration from 1 day to 7 days, after which the stem cells that were collected are returned back to the patient. So that is the process of what we call as bone marrow transplant. It is not a surgery, it is a medical process. Second myth about bone marrow transplant is it is required for all patients who are suffering from blood cancers. The answer is no, it is a myth. It is not required for all patients who are suffering from blood cancers. On an average, we can say it is required only for 30 to 40% patients who have a blood cancer like acute myeloid leukemia, acute lymphoblastic leukemia, myeloproliferative neoplasm, multiple myeloma, Hodgkin's lymphoma. Total, not more than 30 to 40% of these patients may require bone marrow transplant during their treatment journey. Also, for some of the benign diseases like thalassemia, sickle cell anemia, and aplastic anemia, one of the very important curative treatment options, of course, is a bone marrow transplant. Third myth around bone marrow transplant is that it is a very risky process. I would say that we are not living in 1960s when the process of bone marrow transplant was first performed in the world. We are living in 2025. Now these processes have become very safe and comfortable for the patient. The drug toxicities that were very common during the earlier decades have now reduced significantly, and now the chances of getting cured from these type of blood cancers or the type of diseases that require bone marrow transplant is to the tune of 60 to 80%. So these many patients can be permanently cured with their diseases if they undergo a proper bone marrow transplant. Thank you.